Ladies and gentlemen, you're about to experience the Gut Check Project, talking science, health, and innovation that you can actually use. But this isn't just another health show. We're here to have fun and make your time enjoyable. Well, while you are enjoying yourself, know that even though the GCP covers some health topics with healthcare pros, we are not your doctors. So use our show to entertain your mind and not for medical advice. And now, here are your hosts of the Gut Check Project, Dr. Ken Brown and Eric Rieger.
Hey, Gut Check Project fans and KBMD Health family. I'm your host, Eric Rieger, on the Gut Check Project, joined by that guy, Dr. Kenneth Brown. It's episode 102. Ken, we got a revisitor. What's up?
Well, fortunately, we have somebody who is a huge fan favorite, and back by popular demand, we have Taylor Reyes. So if you did not see episode 93 and 93, I say that because it's two parts. It was so good, we had to break it up into two parts. Taylor is a physical therapist with several different specialties, but specifically Endometriosis, which we're going to get into in a second, and also pelvic floor therapy. So, Taylor, would you like to reintroduce yourself?
Yes, I am Taylor Reyes. As you said, I'm a physical therapist. I work in Farmers Branch. I have my own practice. It's FIRE Physical Therapy. In case you're wondering, FIRE stands for Functional, Intentional, Restorative, and Empowered. So I do specialize in pelvic floor therapy for men and women, and I also do what's called functional manual therapy. So it's a total body approach to treatment, osteopathic based. I see a little bit of everybody and everything, men, women, athletes, postpartum moms, not that they can't be the same, not that a postpartum mom can't be an athlete, but a little bit of everything, yeah.
So I love the fact that you take a functional approach to everything, and I'm going to ask a small favor of you so that we have a great show.
Yes.
I have had somewhat of a stressful day, so before we head into this, can you offer a relaxation technique that we can do here on the Gut Check Project before we head into this podcast?
Can you come back for every show?
Yes.
Yes, I can. And actually, I think we're going to do a 2-in-1. So I'll break it down real quick because we know one, diaphragmatic breathing, breathing, engaging the diaphragm is one way to engage the vagus nerve or to improve vagal nerve tone, which helps the parasympathetic system, the rest and digest. So we're going to do some diaphragmatic breathing. I'll walk you all through a little exercise.
Okay.
But at the same time, since I do TMJ stuff as well, and we all tend to clench and grind, and especially if you've been frustrated today, you might be tight through your jaw. So when we go through the inhalation process of this, I want you to take your thumbs, dig it up under your chin, and sweep it back along that bone. Okay?
I need that. I am embarrassed to say this, but next week, I have to go get my new night guard because I grind my teeth at night.
Oh, yeah.
I shattered my night guard.
Oh, good for you.
Yes,
no,
I bit through my night guard. Yeah. I know. So you're saying that, and I'm like, yes, just tell me how to do that. Right now, fix my jaw, fix my jaw.
I think we should connect after the show because that's a sign.
Okay.
Okay.
All right, Taylor's, everyone, if you're listening to this, do exactly as she says. If you're watching this, watch and also do what she says.
Yes. So you might be familiar with 4-7-8 breathing. We're going to take 4 counts in through the nose and then hold for a count of 7 and then exhale through the mouth for a count of 8. Okay. And then while we're going to go through one round of that, and then we're going to add the release in with our hands.
Okay. Excellent.
So ready?
Yeah.
Inhale through the nose. 1, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale through the mouth. 2, 3, 4, 5, 6, 7, 8. Good. That way we can slow it down. We increase nasal nitric oxide, which we love nitric oxide, when we hold, and then we really focus on that CO2 expulsion when we exhale fully.
Okay.
Okay, so now this next time, because everything's relaxed when we inhale, you want to take your thumbs, find the inside of the jaw, like the jaw bone, and they're going to start together at the front, and then as you inhale, you're going to sweep them back to where they line up right underneath your ears.
Okay. I'll go all the way back. Okay.
Yeah, it might, and if you want to play for a second, it might feel a little ouchy or just a little like, ooh, that's kind of tight. You know you're on the right spot if we do that. Okay, so ready? We're going to pair that with the inhale. So ready? Inhale, 1, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Exhale through the mouth. 2, 3, 4, 5, 6, 7, 8. Good.
Very nice.
Yeah. Do you feel less?
You look like a different person, Ken.
I feel like a different person, Eric. We want to welcome to the show, Taylor. Today is March 1st, Endometriosis Awareness Month.
Welcome to the Gut Check Project.
A new tone, NPR style.
Thank you, Taylor.
That was awesome.
That actually was
Yeah.
great.
So I recommend people set like a 2 or 3 minute timer so they're not focused on reps. And then that way they can just take a moment to engage their parasympathetic nervous system.
That's really cool.
Yeah, it's... Oh,
Hi.
before we had her on, I did the little trick that you did to Eric to Devin. She couldn't move her neck. And I got her moving her neck completely.
Oh,
Remember
yes.
that? Yeah. If you look at Taylor's Instagram, which is, what is your handle?
Dr. Taylor Reyes.
At Dr. Taylor Reyes, she goes through a way to manipulate the tongue so that you can get more mobility out of your neck. And it seems crazy, and it works. And things like that, like this. This feels good. I feel better.
Yeah, I feel great.
Yeah. I'm going to call my dentist and say, you don't have to order me 8 more of those. I ordered 8, thinking I would just keep biting through them.
You are ambitious.
Well, that is something I do. I do some oral-facial myofunctional therapy. So I work with dentists to specifically aid patients through the oral appliance process, like if they're doing adult airway expansion or if they're doing tongue tie releases. Maybe there's some fascial restrictions in there that's creating a tongue tie when maybe there's not actually one. I think we talked a little bit about that.
Yeah, we
last
did.
time.
We did.
But yeah, so, again, because, we could go off on so many tangents, but there is, if you're clenching your jaw, you may, not always, but you may be clenching your pelvic floor. And that's going to create this overactivity loop.
Yeah.
So not all pelvic floor patients have TMJ issues, and not all TMJ patients have pelvic floor issues, but a lot of times they can
Exist
marry
together, yeah.
And then we treat both.
I know that we're going to talk about endometriosis today, but one of the coolest things that you discussed in episode 93 is we always talk about core muscles, and she really went into detail that one of the forgotten core muscles is the pelvic floor.
Yes. A third of the core is the pelvic floor
Something totally forgotten.
that men and women have. Everybody. All humans with the pelvis.
Which is most, Ken. Most humans have it.
Most humans do have a pelvis. So that was so interesting that I could talk a whole nother 2 more episodes on that. So just check out episode 93 and then keep requesting Taylor to come back covering different topics, because clearly there's a lot more stuff that we can cover with her. But the exciting thing is that endometriosis, it's Endometriosis Awareness Month. And before you go, I have no idea what that is. I don't have that. It is affecting you, because endometriosis actually affects at least 10% of all women, probably more, because a lot of it is not actually recognized. And so that's what we're going to talk about today. So, and it causes all kinds of issues, but we're going to let Taylor get into it.
Yeah, I think you should. It's something, even as a young person, when I was first told about it by a girlfriend that she suffered from it, I don't have any sisters. I just had no idea what she was up against, and I saw her kind of writhe in pain a handful of different times, and so I didn't fully understand until I got a little bit older, and then went through and had a little bit of medical training. But anyhow, so Taylor,
One more thing before we start there. As a gastroenterologist, I'm just learning how many of my patients probably are suffering from endometriosis when they've been labeled as having irritable bowel.
Yeah,
Or functional bowel pain.
that's fact.
And that's what I love having people like Taylor on to educate, so that I can go back and now when I see my patients go, let's consider this as an option.
Yeah.
So, all right, what is endometriosis?
Yes. Okay. So, but not to put y'all on the spot and not to answer a question with a question, but I'm going to do both.
Okay.
If that's okay.
Yeah.
So, and there's no wrong answer, which I mean technically there is, but I would like to.
Okay, hold on. You're stressing me out.
Okay, so I would like to hear from both of you, just from your clinical experience and how you navigate day to day. What do you know of endometriosis? Like, I mean, it doesn't have to go deep, but just like, what are kind of the top main symptoms, or how would you typically identify it?
I would just, from what I know, is just probably enhanced pain during menstruation, and that's pretty much it. Unless somebody else has already identified that it's involved somewhere else, I'm going to go ahead and admit that's probably the extent of what I know.
So, as a gastroenterologist, when I start thinking about it, realizing that there's a hormonal component to it, when I get somebody that has abdominal pain, I at least want to try and say, do you notice the pain increasing during certain times of the month? And then I have to be aware of it, because since I know that endometriosis can actually cause scarring, patients with this can sometimes have a more difficult colonoscopy. So I'm more interested in is this going to be a tough colon? Are they going to have restricted mobility? Are they at higher risk for perforation? All reasons why you should really understand why somebody could possibly have the scarring issue. So superficially, I know it in relation to my job.
Right.
But I have not really delved into it from a treatment perspective for endometriosis, because I get the patients from the gynecologist.
Yes. And I think you get a fist bump too, because that's great.
Thank you.
Okay.
I was waiting. In case you weren't watching that, I was like, come on. Fist is right here. Do it. Do it.
So, and I'm going to pin something here that we need to talk about in a minute, or in a little down the road, is managing endo via managing systemic inflammation, which gut health. So we're going to come back to that.
Okay.
So yes, endometriosis, you typically have painful periods. And yes, it can create IBS type symptoms. It can create constipation, diarrhea, rectal bleeding, all three. It can create rectal spasms. I mean, it can really create a lot of discord in the pelvic region. So one thing, even in PT school, when I walked out of PT school, I learned it as, if your patient has 10 of 10 pain in their periods and they're bleeding through their pants like 3 times a day, that's endometriosis. That was it. And then that was kind of all we learned about it necessarily. Even taking some higher level continuing ed courses after the fact that had to do with pelvis or some pelvic floor stuff, that we didn't really go past that. As I've started to learn more and more and more, and you read more and more and more, we're realizing that endometriosis, yes, it affects 1 in 10 women. They're finding that you're typically born with it, so it's not necessarily something that just develops over time. And I think to just illustrate the complexity, sorry, I have a hair in my eyeball, illustrate the complexity of this disease, is that there have been 20 reported cases in biological males.
Whoa.
Yeah, of endometriosis.